Welcome to episode 3 of the Bite-Sized Science YouTube series, presented by STEM Fellowship. Today we'll be focusing on the complex topic of organ transplantation, covering the basics of the transplant process, key ethical considerations, and future directions for the field of transplantation. So what is organ donation? It is the surgical removal of an organ or tissue from a healthy person, or the organ donor, and the placement of the organ into another person, the recipient, whose organ has failed or has been damaged by disease or injury. Common transplanted organs include the kidney, pancreas, liver, heart, lung, and intestines. Nationally, kidney transplants have the highest demands. A vascularized composite allograft, or VCA, is also possible. Composite tissues that are transplanted include the face and limbs. Organ transplantation is in high demand, and for good reason. This is a procedure that saves lives and improves the quality of life for many patients, particularly those with terminal organ failure. Let's take a look at some eye-opening statistics from the Organ Procurement and Transplantation Network. 106,274 people are on the National Transplant Waiting List. 17 people die each day waiting for an organ transplant, and every 9 minutes another person is added to the transplant waiting list. As well, the highest age range for transplants is ages 50 to 64. Considering the importance of organ transplantation in modern medicine, you may be wondering, well, how do I become an organ donor? The process to become a donor in Canada differs depending on your province, but the general process is the same. If you want to be a living organ donor, you'll be matched with a recipient and then undergo a transplant surgery. If you want to donate your organs or tissues when you die, you'll first join a donor registry to record your consent for organ donation. You may then also want to let your family and friends, as well as your doctors or religious leaders, know that you'd like to be a donor. In the description of this YouTube video, you'll find a link to the Canadian government's information on blood, organ, and tissue donation, where you can read more about becoming a donor. Although organ transplantation is often a life-saving procedure, it is also associated with many dangerous complications, one of which is rejection. Transplant rejection occurs as an immune response, where the immune system detects and attacks foreign antigens. There are 3 main types of rejection. The first is hyperacute rejection, which occurs immediately after the transplant because the antigens of the recipient and donor are completely unmatched. The second is acute rejection, which occurs 1 to 3 weeks after the transplant and is usually present in all recipients. The last type is chronic rejection, which occurs over many years and can cause significant damage to donor tissues or organs. To decrease the likelihood of rejection, organ donors and recipients are vigilantly tested before the transplantation to ensure that their antigens are matched. This is done in a couple ways, and the first is blood typing, or the matching of blood antibodies. By this system, an O recipient is matched with an O-type donor. An A recipient is matched with an A or an O donor. A B recipient is matched with a B or an O donor. And finally, an AB recipient is matched with a donor of type A, B, AB, or O. Tissue typing can also be performed to identify and match tissue or human leukocyte antigen or HLA types. Lastly, a serum crossmatch can be conducted to observe how recipient antibodies react to donor cells. If a positive crossmatch occurs, or donor cells are destroyed by recipient antibodies, then this would not be deemed an appropriate match. After a transplant, most patients will take immunosuppressant drugs to further lessen the risk of rejection. These drugs block the body from mounting immune responses to donor tissue and organs. However, this does result in a general weakening of the immune system, leaving patients more vulnerable to infections. To balance the risk of rejection and infection, some patients will also take antibiotics or antiviral medications at the same time as their immunosuppressant drugs. One main ethical dilemma surrounding organ transplantation is that of balancing availability and demand. As we've seen from the statistics, there is a significant shortage of organs for sick patients, and this gap is only growing. This then ties into the principle of justice, or the allocation of scarce medical resources in a way that allows each individual to access and receive fair healthcare. If justice is at play here, how do we decide what is just? How does the medical system choose how to allocate organs? There's a complicated set of criteria, so we'll try to simplify it a bit in this video. In North America specifically, demographic and background factors cannot be used to discriminate against patients or otherwise prevent them from accessing the life-saving treatment that they all deserve. Instead, organ allocation is mostly decided based on the principle of maximum benefit, i.e., a patient's life expectancy after receiving their new organ. Maximum benefit is accordingly measured by the number of life years gained by a patient. Other factors for consideration can also be lifestyle-based, such as alcohol consumption, smoking, and obesity. For example, in the case of liver transplant patients, some doctors will apply a policy requiring patients to abstain from alcohol for at least 6 months before the procedure to ensure that they won't consume alcohol after transplantation, since this could significantly harm their liver and overall well-being. However, this policy remains controversial today, and new research is coming to light about the rates of relapse and liver disease after transplantation in people who do and do not abstain from alcohol for a minimum of 6 months. Currently, the idea of individual worthiness based on lifestyle is still being debated by medical ethicists.
Now, let's take a look at future developments in the realm of organs and organ transplants. This field has tremendous potential as it evolves alongside innovations in biotechnology and regenerative medicine. One development is that of non-traditional organ sources. Some primary contenders are engineered organs, where technology is used as a substitute for the real thing. This, however, leads to ethical questions surrounding the use of these cutting-edge engineering marvels, notably how we're going to one day balance therapy and enhancement, as well as address the accessibility of such technologies. Another source is stem cells, which are cells that can differentiate into more specialized cell types and undergo indefinite cell division. Stem cells can be derived from embryos, which are termed embryonic stem cells, or adults, which are known as induced pluripotent stem cells, since they can be reprogrammed back into an undifferentiated state. In theory, stem cells can be used to generate entire organs, but embryonic stem cells do remain morally contentious, as harvesting them requires the destruction of human embryos. A second novel development is xenotransplants, a procedure involving the transplantation, implantation, or infusion of an animal cell, tissue, or organ into a human recipient. There is a very interesting and recent case study of xenotransplantation. Let's delve in and learn what happened. On January 7, 2022, 57-year-old David Bennett from Maryland, USA became the first person to successfully receive a heart transplant from a pig. He was terminally ill from a heart failure and was on an artificial heart machine. He was not eligible for a conventional heart transplant, and so he was offered the experimental option of a genetically modified pig heart. Pigs are the most commonly used animals because they mature quickly, produce large litters, and have organs of comparable size and function to human organs. They can also be bred in a microbiology-controlled environment. Monkeys, on the other hand, are undomesticated, and it is difficult to raise them in the same way as pigs. Additionally, their organs are too small, and they don't give birth to offspring as quickly. Their genetic similarities to humans also increase the spread of disease from the donor to the recipient. The problem is pig cells, like most mammals, are coated with a sugar molecule called alpha-gal, and the human immune system produces a severe immune reaction to this molecule, which leads to the body to reject a transplanted organ. Scientists were able to use CRISPR-Cas9 genome editing to make the transplants possible. CRISPR-Cas9 genome editing uses RNA and an enzyme, Cas9, to locate specific genetic sequences in an organism and cut the DNA's double helix so that sequences can be deleted, added, or replaced. Removing the alpha-gal antigen enabled scientists to create pigs with organs that were less likely to be attacked by the immune system. The surgery went well, and David Bennett was able to live for 2 months before before he passed away March 8, 2022. He lived longer with an animal heart than any other human who underwent xenotransplantation. David Bennett's case is thus considered a milestone in the history of xenotransplantation.
Thank you for watching as we explore the ins and outs of organ transplantation. Check out the description of this video for links to our sources, and make sure to stay tuned for future bite-sized science episodes and videos from STEM Fellowship.